Well, the state of play is what it is. It appears that we're down to the two candidates, and they'll hash it out. And I've been frustrated because I've been watching these debates, and for 5, 6, 7 going back debates, I've been kind of screaming at the screen, going like, "Talk about Trump. Talk about Trump."
Instead of
arguing about, let's take healthcare. Okay, well, it's good that we're all looking to get to universal, but we won 40 seats the last cycle, and we won it for a reason, which is the Republicans win in 16, they have both houses, and they're going to repeal and replace. And what do they come up with?
nada.
23 million Americans lose their health care under that plan. You lose your protections.
Mm-hmm.
States can get rid of all these different protections on pre-existing conditions.
The president says that's not true, but he is in court now fighting to get rid of them, just for the record.
He doubled down. After losing 40 seats, he doubles down and he joins the state's attorneys general suit to
invalidate pre-existing conditions and all of Obamacare.
The entire thing, including free vaccinations.
Mm-hmm.
That's part of the protections of the ACA.
Relevant right now with what we're facing, even though we don't have a vaccine.
That's why I brought it up.
Thank you. Here's the problem, though. They kept doing it. Granular debates about whose single-payer system would happen faster and for more trillions or less trillions. And you're not having that debate in the general, but you were obsessed with it in some purity test. What do you think the reality is of what happens in the general and what you can get done even if you win?
First of all, what we can get done in healthcare if we win may be different from a single payer without insurance. If Bernie wins, when I first got to the Senate, that was when we were crafting ACA, and I went up to Bernie because I knew he was single payer, and I said, "Bernie, if you like, I'll join you on single payer, but we're 58 votes short." And so
what'd he say?
He kind of laughed. So anyway, what we can get, every other developed country has universal health care, but they all have some insurance, private insurance that you can get. So
most do have supplemental plans,
they all do.
Especially for special care and stuff like that. The senator says he can get it all done as single payer, and that's the way to do it. And he has never expressed any flexibility about it. For him, it's about authenticity. What is it for you?
Well, that's what we're hashing out now, and that's a very appropriate discussion. But we need to be talking about Donald Trump and how awful he is as not just a president, but as a human being. And look, right now we have this coronavirus. When you have a crisis like this, the strongest thing you can bring to it as a leader is credibility. And he has none.
He said his reaction today has been perfect. Not as perfect as the Ukraine transcript. I'm not kidding you. That's what he said, but close.
Perfect is perfect. It's either perfect or not perfect.
But he compared it to the Ukraine transcript.
I know. Well, you know how perfect that was.
But what does that tell you about what you're up against? That's what he'll say, talking about coronavirus, while you have 100 debaters talking about the granular mechanisms of single-payer health care.
Well, once we have the nomination, whoever has it, they'll be talking about their plan. It'll either be Biden or Bernie.
What about or bust? What about that as a possibility? They are nowhere near each other, these two gentlemen, in terms of their policies.
I don't think they're that far apart. Look, I was there for the ACA when we legislated that. Bernie didn't get what he wanted, but he not only voted for it, but he did community health centers. That was a big contribution to that. I did the medical loss ratio. Medical loss ratio says that insurance companies have to spend at least 80% of their premiums on actual health care, not on CEO salaries, not on advertising, not on administration. 85% for large group. That should go to 90. But, you know,
that's a great idea in terms of controlling costs and making sure you get effectiveness of dollar.
Yeah, Americans got $1.5 billion back from the insurance companies who didn't meet the medical loss ratio. And before the ACA, there were companies that had medical loss ratios of 40%.
I totally get it. And look, I know you have no official position for the audience. Not Biden, not Bernie. You're watching. You're a concerned citizen and Democrat. But Sanders, it's interesting to hear. We know that he moved with you guys on ACA, but that's not his pitch right now.
Well, if he becomes president, he will try to get single payer without insurance. I doubt very much that he would be able to get that.
Person to person, I don't know how you make that comparison between Bernie Sanders and Donald Trump. I don't see it.
No, it's
but they'll
completely
say,
different.
yeah, except he's equally as inflexible. He's equally his way or the highway. You disagree?
No, that's what I'm saying. When we were doing the ACA, he contributed in the way he contributed. Community health centers is extremely important. It wasn't terribly controversial. We all were for that. There are some things that a public option should have been in that. That was Joe Lieberman killed that. There are a couple things that we could have gotten in there. I think if Scott Brown hadn't won and we had a lot more flexibility to recraft it, but we got what we got. The thing is that we lost big in 2010.
Yes.
We lost the House. In 2014, we lost the Senate because of health care.
Yes.
2018, they lost because of health care.
Yes.
And there's a reason for that. And the reason is people, they can put back lifetime caps.
Yes.
They can put annual caps.
Yes.
They'll get rid of Medicaid expansion. That's what they had in that bill. Let me tell you something about Medicaid expansion. Here are the last 3 states by referendum to approve Medicaid expansion: Idaho, Utah, Nebraska.
And what does that tell you?
Medicaid expansion is incredibly popular.
Except it was politically weaponized, and Republican governors wanted to not do it if they could as a way of rejecting the ACA.
This is how we won the governorship in Kentucky. Kansas just adopted, not by referendum, the governor and the legislature. Right. It's incredibly popular. When they dropped their bill, that would have 23 million Americans would have lost their health care. Part of what they were going to do is defund. There was going to be no Medicaid expansion. Mm-hmm. I went to red counties in Minnesota. I went to rural hospitals. At those rural hospitals, I had these town meetings. People were crying. This is what Medicaid expansion did.
Yeah, it's life or death for them. Other than mostly paying for your mortgage or your rent, this is the biggest nut in most people's lives if you're healthy.
This is what Medicaid expansion did in rural America. These hospitals now had far less uncompensated care. That's meaning right. When someone comes in the emergency room and they had no insurance at all, the hospital ate it.
That's right. Now
they had Medicaid.
That's right.
Now the hospitals had a lot more money.
That's right.
What could they do? They could get more doctors.
Yes.
More technicians, more machines, more nurses.
It's in the research. It's in the data.
And they did that, and they became the largest employer in the county. They could do health care. You could get, your mom could get health care at home. Mm-hmm. I had a couple that was crying because they didn't know what they would do with her mom.
I hear you. Let me ask you something. One, this is not what your people are arguing right now, just so you know. This is not the way they're arguing it.
Well, we'll get a nominee, and that's the way they should be arguing it,
We'll see.
View.
We'll see. The question is, will Bernie change his positions if it's him? Can Joe Biden make the case if it's him? You make the case very well. Do you miss being in the Senate?
Yeah, of course I do. I mean, I could do stuff for people. I could do, like the medical loss ratio. Mm-hmm. I could do, that was a big thing. I could do small things. Because of what I wrote into the reform of No Child Left Behind, foster kids no longer have to change schools if they get a new foster family
made real
outside their
things
district.
happen.
So these kids now can stay in the school that they want to stay because they have a great teacher that they love, or they have an activity, a sport, or theater that they love, or they have these things called friends. And I just know there's some kid that is playing basketball now with his teammates, even though his foster family is in a different school district. I required them to get a ride, give the kid a ride.
It's the beautiful part of public service.
Yeah.
Let me ask you something about.
And I'm continue. That's what I'm doing now, is trying to make a difference
Right.
in a whole bunch of different ways.
And look, and you can.